don't know. I'm making this. I really hate to. No hate. It's not the correct word. Great. Okay, perfect. Hi, Belkin.
Hi, how was your long weekend?
Well, lots of works, but that's okay. How about yours? Everything okay?
Everything is okay.
Perfect. Hi, Ruth. Well, Ruth isn't there. Hi. Hi, everybody. Hi, Ariana.
Hi.
Hi. So
Hi.
today we have a big class, and well, we need to start as soon as possible. Let's wait a little bit more. And well, today we are going to have the medical English properly set. And well, that's a reason because we don't need too much time for expecting our classroom, the classmates, okay? Hi, Ariana. How are you?
Hi.
Hi, everything okay?
Yes.
Okay.
Thank you.
That's great. And Agar Melby, please, your camera, I need to see you. Oh, hi.
Good night.
Good night. How was the weekend? The long one.
It was a lot of homework.
Lots of homework.
Much
Well,
to do, see.
well, we
But
are
it's
going to have lots of homework from today because
fun.
there's not too much time for this course and the topics are so huge. So we need to take it in count.
We
But
have
it's
to work a lot this week.
Yes, and well, patience. That's all we need to know. Okay, we are going to wait 3 minutes more and then we are going to start, okay?
Okay.
And I'm gonna get the session without locking because we are starting a few minutes earlier, and that's okay. Okay. Agar, I didn't send you the answers from the first homework, right?
Yes.
I don't think, yes. Did
I sent you. Did you?
Yeah, you sent me the homework, but the answers. Yes. Okay.
Yes, the answers I sent you.
Okay.
In a
no,
document Word.
if I send you the key of the homework, I mean.
No,
No?
you didn't send.
Okay, I'm gonna do it tonight. I forgot it completely. I'm just remembering.
Okay, don't worry.
Okay, but then,
Oh no, not yet.
Well, as I was telling you, my always people in time. Well, we have lots of topics to check from today because the 3 first sessions were general vocabulary, general topics, and that's why I was asking you if you were finishing the career or you're even a student or maybe another career, because we have a teacher professor in the group And well, I know it's gonna be so hard for our friend to complete and understand many topics and homework. That's why it's important for us to get the vocabulary in the proper way of doctors, of medicine, like we are used to do. So let's start, I think. More people is incoming. Fabiola. Hi, John. Hi, Fabiola. Okay. Let me share the window, the
Hello,
screen.
teacher.
Hi, John. How was your weekend?
It was great, teacher. How are you? How was yours?
Well, lots of work, but that's great. It gives sense to our lives. Yeah. Okay. Can you see my screen?
Yes.
The Medical English 4, right? The first screen I always show. Perfect. So in order for having enough time for doing all the topics, we are going to start, okay? Because there's a lot of material. We have 60 slides. Well, but most of them are pictures, graphs, and many things, okay? Well, at least a classmate is telling me it's gonna be late. So in this course, as I was telling you at the beginning, the principal objective is to learn, to remember as much as vocabulary in the medical topics we are, of course, studying daily. During the career, we get, I consider an interesting way of talking, of getting in contact with colleagues. And we also learn how to express correctly for all the material we have to study and we must complete. In that way, we must understand that we have a specific medical terminology. In English, well, I mean, first of all, in Spanish, we get this vocabulary by practicing and maybe having some grammar topics for understanding, but because it's easier for us, because Spanish is harder than English. That's why I decided to get an introduction medical terminology, a few slides explaining how we can start understanding in English this kind of words, and of course in Spanish is almost the same, okay? We have the 4 types of word parts: the word root, the combining form, the suffix, and the prefix. These 4 types are the most important in the way while we are constructing the medical terminology. I mean, if we are not sure about the meaning, we can guess, we can have an idea knowing how that word is constructed, is made, I mean. The word root is the basic meaning of the term. For example, gastro is stomach, right? We combine it doing the word root plus a vowel, adding it at the end. For example, the O, gastro. We know it's about the gastrointestinal system. The suffix usually, but not always, indicates the procedure, condition, disorder, or disease that we are talking about. And the prefix usually, but not always, indicates location, time, number, or status. For a word root, we have part lines, and we have combining forms indicating the color because of the book we are using, but these magenta ones are explaining us that this, for example, cyan cyanosis. The O is the added one, and the SIS is the explanation of the condition. That's the suffix we are going to check in the next slides, okay? The eryth, we know is for red blood cell. Erythro, the adding vowel, and erythrocyte. We are constructing with the cell word, another root word, root one, a new word, I mean. Leuco, leukocyte, melano, and then, okay? These charts, please read them, read and practice and check the rules, because with these ideas, you are going to have better keys for talking, for understanding, and of course, giving notices, reports, making, I don't know, case discussions and everything. The word part guidelines, our root cannot stand alone. Always has to have or a prefix or a suffix, okay? And always have a combination with a vowel. O, A, I, it depends on the situation. The rules of creating or combining form by adding vowel apply when suffix beginning with consonant is added to a word root. We are going to check it in the next slide. And when a prefix is added, it's always placed at the beginning of the word. Of course, we are not going to mix the way of constructing the words, because of course the meaning is going to be lost. Starting with the suffixes, we have 3 specific kinds of doing for remembering and for understanding. Of course, in Spanish is the same when we make the translation, okay? Suffixes as noun endings, we have these 5 ones. Crani, it's the school. Cranium, here is cranium. That part of the school that contains the brain and the nervous central system, okay? Suffixes with, that means abnormal condition, these 7 ones. Gastro, the gastro that we know is the stomach, the adding O, and cis, gastrosis, we know. And suffixes meaning pertaining to, all of these ones. Cardi for heart, cardiac, okay? The cardiac muscle, for example, the cardiac surgery, the cardiac procedure, the cardiac picture, I mean. Suffixes related to pathology, algia, pain, suffering, example, gastralgia. Dynia, just pain, gastrodynia. You can see most of adding vowels, okay? Iris, inflammation, gastritis. Megaly, enlargement, hepatomegaly. Malacia, abnormal softening, I mean, arteriomalacia. Necrosis, tissue death, sclerosis, abdominal hardening, stenosis, abnormal narrowing, and we have a graph showing us how we can construct with tonsil, tonsillitis, okay? That's an unscrambled way of understanding this kind of terminology that, of course, during the career, we got learning, but not by this topic specifically. Suffixes related to procedures, sentences, abdominocentesis, of course, we know what is it. Graphy, angiography, the gram, angiogram, plasty, myoplasty, scopy, arthroscopy. Okay. The double layer suffixes, range or rasha, is specifically for bleeding. Okay. Hemorrhage or hemorrhagia is the same meaning, but it depends on the situation. We are going to check it when we get into the chapter that we are going to study this topic. Raphy, myorrhaphy, rhea, diarrhea, rhexis, myorrhexis. I mean, in order we are doctors, we don't have to explain all of the meaning from these specific situations, right? But if there's a question, please, we can talk about it in the workshop. About prefixes, Well, as we were saying at the beginning, is at the beginning of the word root influence the meaning of the term. For example, prenatal, time and events before birth, perinatal and postnatal. Of course, we know here the pre, peri, and post are the prefixes. And here we have the example of adding the prefix, and here we are completing with the suffix, so we are constructing longer words. Prefixes describing direction, quantity, size, and amount. The ab, dextro, ex, macro, mega, or megalo, that's the same. Pre, ad, sinistro, from left side, in, micro, micro, oligo, post. Of course, we know it because of practice. Contrasting prefixes, the same situation. Up with ad, abnormal like addiction, dysfunctional, eupnia, normal function, hyper and hypo, inter plus intra, sub and super or supra. It depends on the context we are talking about. And a grammar tip that is important to check. Always we check this guy, because I like it too much. We are going to have a grammar tip. According to the rest of the slides, the classes we're going to have, this guy shows us a grammar tip, okay? So don't forget him, because here, while we check it, we have to keep in mind that we are talking specifically grammar, ways of expressions, or ways of writing, or giving a report. We have the guidelines to unusual plural forms. That's important to know how is the plural, as mouse and mice as the singular and plural. Of course, in medicine, we have the same situation. For example, let me see. Ariana, please, can you read the first one?
Okay. If the singular terms ends in the suffix a, the plural is usually formed by changing the ending to ae. For
Perfect.
example, bursa
Yes.
or bursae, vertebra, vertebrae.
Vertebrae. Okay, can you check the difference, right? How the word, of course, don't get an S at the end, as sometimes we get it in the reports. We say, oh my gosh, what happened? Of course, in this class, we are not going to make that kind of mistakes. And in the way we are finding some irregular words, I'm going to send in you, okay? And even if you find some, we can share it with all of the group. That's objective. Claudia, are you there? Do you have enough time?
Yes.
Yes, hi Claudia. Please, can you read the third one? The one we see without signaling?
Okay. If the singular term ends in the suffix is,
Yes.
the plural is usually formed by changing the ending to
Es, right?
s.
How could you read it?
Diagnosis.
Yes.
Metastasis.
Perfect. So you check the difference, right? So we have lots of rules for these unusual and unusual verbs, I mean, unusual ways of changing the singular to plural. Please study all of them. Study them because we need to keep into the material of the class. This is an introduction for understanding while we are going ahead and not getting in confusion of why the teacher is saying diagnosis, not diagnosis. So we have to keep in mind the plural and the singular, please. Harold, can you listen to me? John Harold. Well, he doesn't say anything. Another one. Belkin, can you talk now?
Yep, I'm here.
Yes, please, can you read the last one, please?
Okay.
The one that I'm signaling.
If the singular terms end in the suffix us, the plural is usually formed by changing the ending to I. For example, alveolus, alveoli, malleolus, malleoli.
Excellent. So you checked, okay, please study these guidelines. Of course, by homework and the test, I'm going to ask from this chart specifically, and especially because it's important, okay? Keeping ahead, let's go. Now we are going to get into today's context. From today, we are going to talk about system, diseases, and symptoms. Of course, symptoms, we are going to check now in a way to understand how patients can refer us with lots of ways of expressions, and signs we are going to be studying during the rest of the course. Of course, while we are going through the different systems and diseases, okay? Let's start. Signs and symptoms, specifically symptoms, is the most I prepared. We have to understand that we are describing problems. For example, symptoms, all the problems which a patient report to the doctor, also called complaints, right? Patients are not coming for us for just talking to someone else or someone new. They go to us vulnerable, I think, because they have a trouble, they have something that is complaining them, and they need an answer about what's going on. And we need to check, to listen, to have enough time for understanding the situation, right? Signs are what the doctor finds, of course, the findings. And in the same way, for example, Mr. Gomez was admitted, we talked about it, complaining of chest pain. Of course, we have in the report, clinical history, or all the documentation, not always the time for writing. And we were talking about, about abbreviations, right? One of the most common and the most important is C/O, the backslash, complaining of. It's understood everywhere in the history clinic. Every part we are using an English called history or written document about patients, the complaining of. There is no other meaning. And if there is another meaning, usually has a high pain, a signal that shows us that it's out of this context, okay? C/O, chest pain, complaining of chest pain. Is that okay? Don't forget this one, because, for example, I'm going to use it a lot. So I'm going to try it as less as possible. Not to write too much. For example, Agar, are you there?
Yes, I'm here.
Yes. Please, can you start reading, please? Patient.
Patients say they went to see the doctor. Doctor says the patient present.
Yeah.
Presenting symptoms, the symptom which causes a patient to visit a doctor.
Synonym.
Synonym presenting complaint, presentation.
Please, stop there.
Okay.
Check the lightened words. When to see, the patient presented. These are the ways of expressions we have to remember, because we are not with the patient next to us when we are presenting the case of our superior, our supervisor, or something like that. We must speak in past. Don't forget this grammar opportunity for learning, okay? This way of expression, because it's easy to make mistakes talking in present, not in past. And while doing that, we get the focus of jokes. And of course, the correct expressions, presenting complaint, presentation, as Agar was reading. Please, Agar, continue. The three bubbles.
He's presenting symptom, presenting complaint, was chest pain. He presented to the GP with chest pain. The usual presentation is chest pain.
Okay. Until here, everything's okay. I think it works, right? Okay. Talking about symptoms, as we said, we have lots, many ways how the patients come to us expressing their complaint. We have this chart that there are some examples about the symptom in the medical way of traduction, in the medical terminology, how the patients say, how they express, and of course the meaning, how what they are trying to say and how we should understand them. For example, Catherine, hi. Are you there, Catherine? Hi, please, can you read the first one?
Tiredness, lethargy,
Yeah.
fatigue, no
Fatigue, fatigue and lassitude.
lassitude. Okay, meaning
Yeah.
loss of energy.
Yeah.
Feel tired all the time. I feel completely wore out.
Worn out, yes.
Lately, I been feeling completely exhausted at the end
Exhausted.
of the day.
Okay. Patients say by this way, giving us some reason explanations, and we have to get the traduction of these ones in order for not wasting time describing this kind of complete words. At least we consider it necessarily. The same rule as in Spanish with the clinical history. The same with malaise, anorexia, weight gain, weight loss, constipation. These ones are just an example of how patients tell us how they feel, how they understand the symptoms about the complaint. Again, I'm telling you. And this is how, well, the meaning, of course. Now, this is the first chart of more symptoms and more symptoms and more symptoms divided in general. Here we are comparing headache, of course, headache, nausea and vomiting, just patients could say just vomiting. Blurred vision, we understand this meaning, but they could say visual problems. We have to ask how the visual problems are, or how is this? Sensitive to light, blah, 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 and feeling like in fog, feeling mentally foggy, I mean. Fatigue or low energy, fatigue, and in this way, please, all of these lists, check them, study them, because these symptoms we are going to use for having tests. Okay, when is going to have the test, I'm going to finish working on it, and I'm going to tell you. For example, and I'm sorry, by these ones, fevers, chills, and flashing, light sensitivity. We have to understand the expression of the patient, how we should understand. Shortness of breath, poor short-term memory, or something like that, cough. We have to understand. Those lists I've been looking for them in order to show you the variety of the expressions we can get with our patients. Of course, it's not the same with, it's not the same talking about an easy chart and not long chart. like having more problems that we should understand. Okay. Please practice and doubts about meanings, pronunciation in the workshop. Please reading. That's the way I'm going to know if you are checking the material I'm sending you. Let's continue with the bones. Bones, of course, the musculoskeletal system. Now we are going to talk about bones, joints, and muscles. First with my dancers. We are going to check the structures, combining forms and functions of the skeletal system, having the major structure, the combining forms, and the primary functions. We have this chart explaining us, of course, the function of every part that we are going to talk now. For example, John Harold, are you there? Now, are you ready for talking? Oops, it's not okay. Well, Ruth, are you there?
Yes, I'm here.
Hi. Yes, can you start reading the chart, please?
Okay, the major structure bones related to combination forms, os, oster, ost. Primary functions act as the framework
Perfect.
for the body, protect the intestinal organs, and store the mineral calcium. Bone marrow relate to also means spinal cord or mile. The primary functions is red bones marrow forms, some blood cells, yellow bone marrow store fat. Cartilage related to charms or chondro.
Chondro. Yeah.
Chondro primary functions creates a smooth surface for motion within the joints and protect the ends of the bones. Joint related to arto work with the muscles to make a variety of motion possible.
Yes.
Ligament
okay. Oh, no, that's okay. From this part, you can see in the primary functions, we have lots of words for vocabulary, right? Or I mean, this is not the common Spanish, the social way we learn to speak in English, I mean, because all of us are from Spanish maternal language, while learning and studying English, medical English specifically, we have to know, we have to understand that we have a formal way of talking in order to give a kind of directions, I mean, of like giving orders. For example, protect the internal organs. It's not a question, it's a function that it's not going to vary through the time. Okay? For example, the red bone marrow. This is a completely new way of talking, I mean, because not always we say, oh, I had an injury in my red bone marrow. Of course not, it doesn't happen, of course. Or we don't say about ligaments, we don't say I have an issue in my ligament. No, of course not. It doesn't happen in the social way of talking. That's why we're going to gain lots of vocabulary. And of course, in the way I was telling you, we're going to have lots of homework because medicine is in that way. The easiest part we were making in the last week. So let's do our best, I mean. And well, let's continue. Johan, now you are into the class. Welcome.
Hello.
Hello. Don't worry. The class is going to be open until until we finish because we have lots of topics to talk now. Can you read from ligaments until the end, please?
Okay. Ligament, ligamento, connect one bone to another.
Perfect.
Synovial membrane, synovial and synovial. Forms of lining of synovial joints and secretes synovial fluid.
Perfect.
Synovial fluid. Synovia or synova. Lubricant that makes smooth joint movements possible. Bursa, burso. Cautions areas subject to friction during movement.
Perfect. So with all of these primary functions, now we are remembering the topic idea of the anatomical function of every major structure. So let's continue. The word parts, as I said before, our grammar key. We have the ankle, arter, chondro, chondri, cost, cranny. This hyphen shows us that this is a suffix. Those the ones that are without hyphen are prefix. For example, hypo, lordo, lysis, mild, all of them. The blackened ones are the meaning, and we have to know them for understanding that while talking in medical proper language, we are not going to traduce all the meanings, okay? And we have the correct way of writing down these words for not making mistakes while everything we make, while medical reports and the way it's always telling you. For example, ose, osi, osto, oste, it's bone. 1, 2, 3, 4 ways of saying the same word. That's complicated. Scolio, spondyle, spondilo, synovio, synovo, yeah, the singular noun ending. We are going to check it there. Now, getting an anatomical review so fast because vocabulary is important. The bone tissues. We have our beautiful graph. Epiphysis, diaphysis, distal epiphysis, and all of the components, okay? Again, the third and the last one. John Harold, are you there? Okay, there's no answer, so
Yes, teacher.
I'm going to notice.
Yes,
okay, the last opportunity, please. If I ask you for, don't do this to me. Don't do this to you, please. Please, can you read the bone tissues?
Yeah. Periosteum, number 1. Number 2, compact bone. Cortical bone, spongy bone, cancellous bone, medullary cavity, medullary endosteum, bone
Perfect.
marrow.
And those. Hi, maybe connection.
Hello? Yeah, should I continue? Or?
Yes, continue, please, continue.
Okay. Bone marrow, red bone marrow, hematopoietic, yellow bone marrow, cartilage.
The articular, sorry. I mixed
Articular
it.
cartilage and meniscus.
Perfect. This one's compact bone is the same as cortical bone. Spongy bone is the same as cancellous bone. It's not the meaning, it's just a synonymous while talking or reading a report case or a report or something different. If you read spongy bone, that's great. If you read cancellous bone, that's great. It's the same. It doesn't, I mean, these meanings doesn't vary from country. Everywhere we have these two options. In Spanish, we have just one option, but in English, we have two. That's the way we must understand it. Here we have our skeleton. As I was doing the last classes, this is the most complete I found from two visions for understanding. And please check it, read it. practice the writing down because, of course, it's important how we write down. For example, the calcaneus, talus, of course, Latin is always in the English ways of writing. And of course, it's mixed with the English ways like sigmatic bone, ulna, radius, that was Latin. Ilium is Latin, pubis is Latin, ischium is Latin. Hip bone, English, yes, easiest. So check it this one as in the way we're doing with your first top model. And of course, we have the common names of bones that patients come to tell us. Okay, those common names are the way like non-medical people talk about these structures. Does anybody want to read some of them? A volunteer, I mean.
I can.
Yes, go ahead, please.
Skull, cranium, jawbone, mandible, spine, vertebra, column, breastbone, sternum, rib, costa, collarbone, clavicle, shoulder blade, scapula, thigh bone, femur, kneecap, patella, shin bone, tibia.
Perfect. The common name, of course, is the way that patient is talking to us. Don't forget it, because when I send you as homework, I mean, just giving you a first point of view. I'm going to talk as a patient using this kind of words. And in your report, you must use the anatomical name, okay? So we have to know, to practice. And if there is any doubt, of course, no matter the time, the hour, you can write me down a message and I'm going to tell you, because time is not enough for all the topics we must cover now. One of the most important situations talking about bones, of course, are fractures. I mean, no, well, the most common that we see, the most talkative, the most, I don't know, the most complaining situations that patients consider is the worst one, okay? Of course, is the break in a bone. And we have a variety, the pathological fracture, and that is a fracture in a diseased bone, okay? Fatigue or stress fracture, of course, is due to repeated minor trauma. For example, long distance marching or running. It usually happens in elderly people or people with rheumatic fever or osteoporosis, osteochondritis. I mean, with many situations that get especially our feet in stress, in I don't know, in a work that it's not able to make. About the typical bone fractures, we have these 6 situations. I mean, we all of us checked during the career. If don't, there's no problem. The green stick, the spiral, the comminuted, transverse, compound, and compression ones. The clinical presentation, of course, we know. We are not going to check this part, but we have to get the idea that this is the way we're going to find the fracture. And we can remember, we must have in mind all the time that these fractures can occur in any part of the body. Forearm, thigh, finger, skull, ribs. I mean, look at this, lots of fracture. This is a big trauma, I mean, in feet. And talking about x-rays, those specific ones. We have the green stick. Of course, we remember the cortical, the buckle is formed, and the cortical braid is not complete, just like a plant. I mean, we know in just people watching this kind of structure, we can infer, we can guess the age of the patient. Does anybody want to give an idea how old was this patient? Hello, maybe 1 or 2 can talk about it. Ariana, do you have maybe a an idea how old could be this guy? Hi, Ariana. Do you have audio? No, if there's no idea, don't worry. It's just for practicing and for
Okay.
understanding that graphic fracture is always in just people, children, maybe teenagers, but no more. When we get young and adults, of course, we are not going to have a green stick because our bones are not as elastic as theirs, right? We must remember that. Checking this radiograph maybe has 10 or 12 years, no more. No more. This development is not enough. And the position is not the best for checking the age, but this space gives us the idea of how old is the patient. This one, the chalk stick fracture. Have you ever seen a fracture like this, John Harold? I mean, because I know you finished the career.
I have never seen a fracture like this.
Never check the chalk stick. Okay, This one is common while, for example, we have osteoporosis, like our first big situation. In osteoporosis, we take excess of calcium for trying to get recovered from this situation, for remaining. For making a good action, sometimes we make the mistake that this bone gets so hard, and usually in elderly people, that is taking calcium for a long time and falls down. Of course, it usually happens. The bone is so hard and cannot get the correct position and breaks like a chalk. It's very lined one. Of course, it's surgical. The patient can come walking like this. The imagine is seen like this. You can see this ring. You can see this soft line. And when you induce your patient into anesthetics, move the patient, you can displace, you can move the fracture and then go to operating room. Type of situation, and you can choose the correct treatment or the correct material for correcting it, right? We have the compression fracture. Who's my victim? Agar, may I talk to you?
Yes, I'm here.
Yes, my dear. Can you describe this vertebra? Try, just be creative. Use your English in order to explain us what you see in this radiography. Don't worry if you make a mistake. Of course, all of us here are learning, and there's no problem if you say something that maybe is not the way, because we are learning. That's the reason for this course, learning how to explain these kind of situations.
Maybe I can, maybe I'm wrong, but I can see as.
Oh, don't worry.
It's hernia. It's the space between the vertebra L3 y L4. L3 and L4 is reduced. And is common that we see in the RX is pico de. I don't know how to say it in the.
It's the pico del oro.
Pico del oro. Pico del oro, but
Yes.
I don't have to. I don't know how to say in English.
Okay,
And it's common to see that in spondylo. I don't know how to describe that.
Don't
but
worry.
I have no idea. Spondylo. I don't remember in English. Spondylolisthesis.
The spondylolisthesis. It's the same as in Spanish.
Okay. Spondylolisthesis.
Yes, the difference is in writing, but the pronunciation is almost the same. Don't worry.
Okay. Yeah. It's a spondylolisthesis. I can imagine that this person can be in the age of 27 and 35, because in this range of age, they usually see that kind of illness.
Yeah, that's great. That's correct. We are going to check this situation during the workshop, one by one, that kind of signs, okay? But the pico del oro, yeah, the osteophytosis, the abnormal growing sharpened parts of the in the vertebra specifically is very common, very usual, while in our country.
Yes.
The stress fracture. Agar, can you describe this lesion? Have you ever seen one like this? Oh, I'm sorry, Belkin. Agar, you just participate. Hi, Belkin.
Hi.
Hi, can you describe this situation? Have you ever seen one fracture like this, the stress fracture? It's very common in runners.
I never seen this before.
I'm sorry?
I never seen this fracture before. Sorry, I have problems with my internet connection.
Okay, don't worry. Okay, Ruth, are you there?
Yes, I'm here.
Okay, did you see a situation like this? By any way, I mean? Any similar situation? Maybe not?
No, I don't remember any of that.
Okay, don't worry. As I was telling you at the beginning of this part of the presentation, it usually happens in runners, in, I don't know, these people who loves trekking, goes walking ahead without the correct shoes, without having the correct, I don't know, the equipment for having the control, and of course making an effort that body is not enough. It usually happens too in rheumatoid arthritis, and well, it's a signal of complications in that kind of situations. We are going to see it. About the healing the bone process, of course we know how it happens. We studied it during the career. We have a remembering of the days, how the process is going on. We have here lots of words for vocabulary that we have to check. And we have the idea of how this process is going on. Okay, so let's check this situation, taking in account the vocabulary specifically and the way it's writing down. It's the same, but with a better explanation, with vocabulary and the correct way of expression. And we have this one, these situations. For example, Johan, now you are in your social service, right? Johan, are you there? Well, there's no answer. Catherine, are you there?
Here, teacher.
Yes, Catherine. I mean, let me check. You're in the orthomolecular system. When you were in the career, during the career, I mean, did you see any situation like this kind of fractures in babies and newborns specifically? Have you ever had a situation like this? Because here in radiography, we can check all the process of the healing with all the stages. But it's different when you see a patient and of course you can practice. Never. Well, don't worry. John Harold, maybe did you see one of them? Because, well, I mean, it's not a common situation, but it could happen.
Yeah, I kind of remember, but I don't have it so sure. I'm not sure about it.
Okay, don't worry. But of course, this situation in this radiograph, specifically these pictures, we have all the process, all the stages well documented. for following the situation or following the remodeling, okay? And study, again, the vocabulary that is in the description, that it's not complicated. About the treatment of fractures, of course, we have the fragments of a broken bone and healing together. We call this process unit. Bones need to be unit again. The union may be promoted or helped by reducing the fracture. We must reduce it, replacing the fragments in their anatomical position if they are displaced, okay? This way of talking, this way of expression is the correct way of showing how the treatment is going to be done. And this is the same vocabulary and way of expression we are using in this explanation. And this one, of course, we have the same. Why I'm taking time for explaining this is because we're talking in a correct way, okay? The words you need, promoted, and reducing are extremely important in a way of talking with any other doctor, and don't be the point of jokes. I tell you by experience. After reduction, excessive movement of the broken bone is prevented by the fixation, either external, for example, a splint, or a plate and screws that are put by a surgical procedure, of course. We have the fixation by cast, or we have by plate and screws. And of course, we are going to see then another slide, the splint. And as a complication, a displaced fracture that is not attended in the moment, which is not reduced, which is not treated, may result in malunion, incomplete or incorrect union, of course. The malunion is very common when we are in province in our social service. We can check it because, of course, patient says that it's not important, it's just a hit and it's going to pass away. But certainly through the time, they see the consequences and, well, there is nothing more to do. Or maybe again as a surgery. Complications, of course, the malunion, the one we're talking here, or the non-union. I had a patient who had this situation because with osteoporosis, the non-union is very frequent situation. It's a cause of chronic pain and chronic immobilization, loss of movement, loss of capabilities. It gets the patient into a situation that it's not the correct, because we have to know how to treat this in the moment, okay? Talking about cast versus splint, of course, it's not the same device. We have the differences, so use of each one and the way of I don't know, in the way of choosing and deciding which one is the correct one. The cast is completely encloses and encircles a limb, like in this picture. And the splint doesn't. You see, we have two kind of cast. This is the splint, a partial one that we can remove, we can take away for washing, for cleaning, for remodeling, I don't know. We can move the splint. The cast, of course, we cannot move. The cast is not attached by Velcro straps or bandages. The splint is attached by Velcro strap or bandages. Of course, it's moved. The cast, always custom made. We have to make and perform it. We have to take in order to the size of the patient limb. And of course, the splint not always is made for the custom. We have to know that it's just one size, and we have to adjust the piece of the patient limb. The cast cannot be attached by an MNT in the field. And difference is the splint that can be attached by EMT. The cast has to be cut off by saw or blade to be removed. The splint can be removed by unstrapping or unbandaging. No saw is needed. It's one of the most important differences why patients prefer to wear a splint instead of a cast. The cast cannot be adjusted if swelling decreases or increases. A splint, of course, can be adjusted. The cast takes quite a long time to make. Of course, we have to get all the material and of course the experience for installing a cast. And the splint takes a short time to make. And of course, it's easier to adjust a splint. It is easier. You can remove, and again, put it again, and again, adjust, or it depends on how the patient feels with the device. The difference, of course, we know, and if a splint it's not well adjusted, has no object of being. It's more a problem than a solution. And we have our funny situation. Look at this immobilization. Of course, it's not the correct way. We have this. Are you sure the correct treatment for a broken leg? Of course not, we know it. Let's talk about the joints. Joints, of course, also known as articulations, are the place of union between two or more bones, okay? That's the responsible for movement, for our capability of going one place to another. The anatomical landmarks, we have this enormous vocabulary in this graph just, and it's a way of remembering, an anatomical way. We have the fiber joints, cartilaginous joints, synovial joints. I need a volunteer for reading, please. Does anybody want to do it? Of course, it's going to make a difference in your score. Yes, go ahead, Belkin. Thank you so much.
Okay. Fibrous joints, inflexible layers of dense connective tissue hold the bones tightly together.
Perfect. For example,
fontanelles, known as a soft spot in newborn sutures, are adults.
Perfect.
Cartilaginous joints allow only slight movement. Bones connected interrelated by cartilage. Ribs connected to the sternum. Pubic symphysis. Synovial joints.
Yes.
Synovial joints allow a variety of motions articulates come together.
Yes.
Like
yes, to say articulate is the same as come together in the writing expression, okay? Perfect, Belkin, thank you so much.
You're welcome.
We have the 6 major joints, the most common ones that we are used for studying. The ball and socket joint, hinge joint, saddle joint, ellipse joint, pivot joint, plane or gliding joint, of course, just examples. How the vocabulary is so extensive, okay? So huge for studying. And we have the difference between tendon, ligament, and cartilage, of course, with definition, terms, and function. Any other volunteer?
Me, I can read.
Oh, please, Agar, go ahead.
Tendon definition: a tendon is a band of tissue that connects muscle to bone. A ligament is an elastic band of tissue that connects bone to bone and provides stability to joint. Cartilage is a soft gel-like Bending between bones and project joints.
Yes, padding. The padding. Padding between bones. Yeah, padding.
Padding between bones and the project joints facilitates movement.
Facilitates movement, yeah.
Facilitating movement. Nature tendons are inelastic and taut.
Yeah.
Ligaments are elastic and strong. And cartilages are stiffer than ligaments.
Yes, stiffer.
Stiffer than ligaments. Types tendon, connective tissue. Okay, a ligament connects connective tissue as well, and cartilage, skeletal tissue.
Perfect.
And the function of tendon is a connect end of the muscle to any place of the bone. A ligament it connects bones to bone at joint, and the cartilage it protects bones and stop them from the gnawing together by acting as a cushion in between bones.
Perfect. As you see again, there's a lot of vocabulary, pronunciation that we must practice. That's okay. And we have a list, just a list of pathology of the skeletal. Not talking about each most important situation, I mean, because of course we don't have enough time for talking with all of this material. We are not here for studying again medicine. We are here for gaining vocabulary, of course, and this list is going to help us to organize ideas for homework. From this pathology list in joints and spinal column, bones, and of course fractures and complications maybe that are here, I'm going to send the homework taking situations from here and asking you for a medical report. I mean, doesn't matter if we didn't watch or didn't work with the patient with a situation like in the chart, but we all read it in textbook and we have to practice how to explain it in the correct expression way. That's how this presentation is about it. Use the correct expressions in talking and learning how to talk with colleagues, okay? So finishing the class today, I'm going to send it. Let's talk about muscles. I need a volunteer, please. Who wants to read it? Somebody maybe.
I can read it.
Yes, please, Ruth, go ahead.
Muscles, they relate to muscle, or myos. Primary functions make body movement possible, hold body erect, move body fluid, and produce body heat.
Perfect.
Fascia relate to fascia or fascio. Primary function covers, support, and separate muscles. And tendons relate tendo, or tendino. Primary function attract muscle to bones.
Yes,
to
the
bones.
muscles to bones.
The muscles to bones.
Perfect. Thank you, Ruth. Okay, going ahead. We have our word parts. Again, the prefix and the suffix in order to construct our terminology. B, of course, twice, double, or two. The cele, an hernia, tumor, or swelling. This, band, difficult or painful. Fascia or fascio, fascia, fibrous band. Fibro or fibrous tissue, fiber. Aya, abnormal condition, disease. Plural of ium. The ium, don't forget it. It's the way. It's another finishing for the for the differences between singular and plural we were watching in the beginning. The IC, preparing to, kinase, kineso, kinesio, the movement, myo, muscle, plegia, paralysis, stroke, rexis, the rupture, taxo, coordination order, teno, tendo, tendon, you know, all the beginnings, the tone, stretching, tension, the tree, of course, tree. The structure of the muscular system. We have again an image for remembering, or having the idea of the anatomical situation and maybe a physiological way of working of these structures. And having the idea that we have this vocabulary too for introducing our vocabulary. Wait, what happened? And we have this tip, the tendons and ligaments. Tendons connect muscle to bone, ligaments connect bone to bone. Of course, we know it. And types of muscle tissue. And let me see, who's my victim now? I'm going to call somebody who's not talking. Fabiola, hi, are you there?
Yes, teacher, I'm here.
Hi, Fabiola, can you read, please, this slide?
Okay, types of muscle tissue attached to bones make possible body motions.
Sorry, this is the skeletal muscle.
Oh, okay, I'm sorry. A skeletal muscle.
Yeah.
A
go ahead.
fiber. Striations across strips. Many per fiber.
Yeah. Please read this one. Okay. Did you read these voluntary muscles?
Conscious control over these muscles, also known as straight muscles, straighted equal stripped.
Perfect. Muscles, don't forget, no muscle, muscle. Without the C, muscle, okay? The C is for grammar, muscle. Okay. Johan, are you there, Johan? Second time I'm calling you.
Yes, I'm here.
Yes, please, can you read the smooth muscle, please?
Okay. Located in the walls of internal organs, such as the digestive tract, blood vessels, and ducts leading from glands. They move and control the flow of fluids through these structures. Involuntary muscles, they are under control the automatic nervous systems, also known as unstraighted muscles, visceral muscles.
Perfect. Please, it's blood, not blood, blood. That's an exception in pronunciation, the double O. Okay?
Okay, thank you.
Okay, the blood and the flow with the complete O, flow, like dancing in flow. We have the flow, don't remember. don't forget it. Okay, thank you, Johan. Thank you so much, that's great. And let me check. Ariana, can you read the third one, please? The myocardial muscle.
Of course, myocardial muscle, also known as myocardium or cardiac muscle, from the muscular walls of the heart. Involuntary muscles, it is the constant contraction and relaxation to cause the heartbeat. In appearance, look like a strained skeletal muscle.
Perfect. I mean, this remembering time is going to help us for writing down, for getting clear, of course, the vocabulary. Of course, we must remember the contrasting muscle motion, flexion and extension. Does anybody want to explain this? Maybe a comment, I don't know. For example, John Harold, can you try to do this topic? Explain this flexion and extension work of the muscle?
I actually have some trouble trying to watch the presentation.
Oh my God, okay. Don't worry.
Maybe the connection, I don't know.
Yes, connection maybe is making us a joke. Yeah, I mean, yeah. Okay, anybody wants to try to explain this by its own words? I mean, there's no trouble if not using the medical terms, of course. That's the first class we are using properly this kind of vocabulary. Does anybody wants to do this? Like a volunteer, I mean?
I can try.
Yes, please go ahead.
So flexion means to have a muscle contracted in action, and extension would be to have a muscle relaxed.
Perfect. And it makes, of course, the movement of the bones and getting our, for example, our arm up and down, right? That's all. Well done, Maria, Maria Fernanda. Of course, we have the abduction and adduction, the circumduction and the rotation. These movements that, of course, we might know. We know because we studied it in the career, during the career in our faculties. The pronation and the supination, dorsiflexion, the plantar flexion, for example. We must remember how the dorsiflexion bends the foot upward at the ankle. Plantar flexion bends the foot downward at the ankle. Of course, this is just for a correct expression. And we have the superficial muscle names. This is a good model, I think. Easy to understand, easy to study. And remember, depressor anguli oris. Depressor in English, anguli oris in Latin. Now a combined form for expressing the function and the muscle we are talking about. Pectoralis major. Perfect. Biceps brachii and vastus lateralis. So we must understand these combinations are usually in English speakers. So that's why I was telling you at the beginning of the classes, in the first one, I mean, that Latin is a common language used in this kind of medical terminology. And well, it's not a dead language as we were thinking in some situations, but we must practice and practice and practice. It's getting accustomed ahead. We have the medical specialties related to the muscular system. Of course, we were talking about this in another presentation, the second one, I mean, about the allied medical professions. Of course, each system has its own allies. For example, the exercise physiologist. We have into parentheses the pronunciation of the new word, okay? Neurologist, physiatrist, sports medicine physician. I mean, it's not so hard, but that's because it's without pronunciation. Maybe, you know, Claudia, do you have enough time now? Or maybe it's difficult. Maybe she's with patient, now she's at work. Catherine, are you there?
Hi.
Yes, can you read please this chart, this slide, I mean, the first two ones.
Medical specialties related to the muscular system. An exercise physiologist is a specialist who works under the supervision of a physician to develop, implement, and coordinate exercise programs and administer medical tests to promote physical fitness.
Perfect. Next one.
A neurologist is a physician who specializes in treating the causes of paralysis and similar muscular disorders in which there is a loss of function.
Perfect. Thank you so much. Ariana, can you read the third and the fourth one, please?
Okay, a physiatrist is a physician who specializes in physical medicine and rehabilitation with the focus on restoring function. Rehabilitation is restoration following disease, illness, or injury of the ability to function in a normal or near normal manner. As a sport medicine physician specializes in treating sports-related injuries of the bones, joints, and muscles.
Perfect. And now you can see little new vocabulary here. Of course, we are talking about is from the second chart of the second class, I mean, and all of this presentation, all of the slides with some of this vocabulary. And then we can go to the pathology of the muscular system. Of course, again, a list, just a general view of few situations, because of course we have some more of them. And as I was telling you, and we are going to use this kind of charts for choosing situations and giving medical reports, medical explanations, or maybe explaining something about it, okay? And don't forget, John Harold, can you try to read it, please?
Yes. Never give up. Great things take time.
Of course, medical English takes lots of time, lots of reading, lots of practicing. And of course, we are here for practicing and making mistakes. Don't worry about a mistake you make. That's the objective of this course. While practicing, we're going to get experience, and then we can complete all the topics we certainly need for doing it. Until here, any question? This is the presentation I prepared for today. And of course, we are going to have homework, as I was telling you on the class. But I'm going to send it while finishing. I mean, a little bit more because I want to complete a few topics. Any question do you want to make now? Something is calling especially your attention. Hi. Does anybody want something to say? Okay, there's no problem. So I want to ask you questions. How many of yours were taking notes? I mean notes because in the way it's going to be on YouTube for checking again the video, of course it's going to help because now connection is failing. I mean for too much people, I think. It's a way for checking again, please. The presentation I'm going to send you to the group, of course, always with it. And then let's go to practice. Participation, of course, I'm going to take in count in order for having a plus in your scores of the first homework and again going ahead. Of course, the participation of this class is going to go a plus of the homework from this specific topic, okay? And tomorrow in the workshop, we are going to talk about it. Please, from the list on the two topics, I'm going to ask in the group, ask for you which one you want to talk about just for this time. Next ones I'm going to choose instead of you. This time, let's try this way. this volunteer way. Any question you would like to make now? Or everything's okay?
Tomorrow we're gonna have the workshop, right?
Yes, tomorrow, yes. As you were watching, this presentation has definitions, graphics, some body parts, inner ones, the skeleton, the articulation, the joints, and the muscles, because it's too much material for reading. And I want to unmix it in order for not making a complete mess talking about 5 or 6 topics and not have enough time in the workshop for talking. The classes we have now to make are, with this one, are 5, and the topics are divided into get a chronological, a logical order for getting into in a better and easier way. Okay, any comment you would like to do? Any question maybe now? If there is nothing new. Okay, everything's okay, so?
Well, no, for me, it's okay.
Okay, perfect, Ruth. You're going to be the voice of everybody because nobody says anything. Please, so we are almost finishing 30 minutes later. That's okay. Please, let's fill in the diary pool. I'm sending it now. Can you watch it? Nine of 11. Okay, I have 9 people. Let me take this one out. Okay. We all fill the pool, right? Because it's for assistance. Okay,
Yes.
yes, perfect. In the way we finished this, we can go home. Have a good night. See you tomorrow in the workshop. And let's practice. Please read the presentation. I'm going to send it at this moment for taking time. And any question you have tomorrow, we can talk about it. Okay. And about homework, as I was telling you, I'm going to send the topic later. Give me a few minutes, please. I need to check up my babies. And then
Okay,
we
thank
have
you.
time
See you
for making.
tomorrow.
Okay, see you. Bye-bye.
Bye.
Have a
Thank
good
you.
night.
Bye.
See you tomorrow.
Bye.
Bye.
See you tomorrow.
Bye. Bye-bye. Okay, we finished the class. That's great for me. That's the topic I was preparing for and reorganizing. And okay, let's wait for it. John Harold, are you there? Well, don't worry. See you tomorrow, Harold. And please practice the vocabulary.